Good morning, everyone. This is Kevin Doherty, and greetings from Calabash, North Carolina. Welcome to my first Medicare Conversation webinar for the 2020 annual election period. Housekeeping items. This is a live event and is being recorded. The recording will be posted on my kmdinsurance.com website by tomorrow, October 5th. If you are attending the live event, please note all attendees are in a listen-only mode. We will have ample time for questions. If you have a question, use your GoToWebinar control bar. You may need to click an arrow to enlarge the area in which to type. Your questions will post on my screen, and I will address during the question and answer period. You're also welcome to type any comments or requests for future webinar topics. If you're listening to the recording, you may email me any questions or comments, kevin@kmdinsurance.com. So let's get started with the webinar for October 4th, 2019. Status update. As you know from previous webinars, I have partnered with URL Insurance Group for the 2020 annual election period. Candidly, my original goal was to obtain assistance this year with the high volume of review requests I received. With the introduction of the new Plan Finder tool, however, URL Insurance Group's role has become vital to handling your review requests. As a reminder, this service is free to you. There is no fee and there is no obligation on your part to make any changes. So far this week, I've received over 100 review request forms. The forms have been forwarded to URL Insurance Group, and the licensed representatives have started working on your request. One of the first steps URL Insurance Group representatives will take is to send you an email, which will be an electronic scope of appointment confirmation form. This is a required step by Medicare because it is the plan for URL to set appointments with you after October 15th. And in order to set that appointment, the scope of appointment must be on file. If you agree to a plan change during your appointment with URL, and again, the appointments will be after October 15th, URL will handle the enrollment and subsequent service for you. Now, I've been working with the Plan Finder tool. I cannot log in, of course, for saving and for report purposes, but I have been working with the Plan Finder tool, and I thought I would highlight some of the information for you in the event that you're working on your own reviews. Of course, the Plan Finder tool is accessible at medicare.gov, and you have the opportunity to log in using your My Social Security username and password. If needed, you may create a username and password to have access. 2020 plan information is available. The Medicare website was loaded with 2020 plan information on October 1st. Now, of course, the annual election period doesn't actually begin until October 15th, and it will run through December 7th. If you enroll in a new plan during the annual election period, the effective date will be January 1st, 2020, and you will be automatically terminated from the current plan. So if you take the step to enroll in a new plan for 2020, you do not have to notify your current company that you'd like the plan to be terminated. It will be automatic on the part of Medicare. Mail order results are inaccurate. As I have been using the Plan Finder tool, I noticed that the mail order results are for standard mail order pharmacies. Now, if you're using mail order with your current company, in all likelihood, you're using the insurance company's mail order pharmacy. For example, Humana uses RightSource. United Healthcare uses Optum Rx. These are preferred mail order pharmacies for the given plan and have significantly lower costs. Well, unfortunately, the current Plan Finder tool is bringing in results for a standard mail order pharmacy, and therefore the results are completely inaccurate. It's grossly overstated. So keep an eye out for that if you're running your own reviews. Also, in the past, when I would be running reviews and forwarding reports for my clients, often I'd be plugging in a one fill medication or two for the year. For example, the Shingrix vaccination. Well, unfortunately, the current Plan Finder tool requires you to enter a medication for monthly use, every 2 months, or every 3 months. So if you're filling a cream, a lotion, or the Shingrix vaccine, you have to plug it in that you're taking it no fewer than once per quarter. And that will greatly inflate the numbers for the results. You have the opportunity to sort by total drug cost. The total drug cost would be your out-of-pocket expenses for the medications that you've entered and will include the cost of any deductible on the plan. But it does not include the premium cost. Now, again, the previous Plan Finder tool would allow me to inform you what the total out-of-pocket cost would be for a given plan. Total out-of-pocket cost would be the premium, the deductible, and the cost of the medications. And I could give you one total, so it's a very easy comparison among all of the plans. The new Plan Finder tool does not allow for that. You can sort by the total drug costs, but you're going to need to take the time, if you're running your own reviews, to calculate the premium. So you would take the premium times 12 and add it to the total drug cost. Only then could you find the plan that will truly provide you with the lowest out-of-pocket cost. I'd like to state here, too, that if you're taking advantage of URL Insurance Group, the software that URL is using does not have these errors. This is only if you're doing your own review using the new Plan Finder tool. Now, Envision and Humana members, you have significant changes occurring. We start with Envision. If you are an Envision member and you're in DC, Delaware, Maryland, New York, or South Carolina, due to a quirk with the Medicare rules, you will be automatically switched to a different plan offered by Envision for 2020. It's the Envision RX Secure Plan. The Secure Plan has a significantly higher premium and a higher deductible, and it's unlikely it would be in your best interest to accept the Envision RX Secure Plan. So in order to keep the low-cost Envision plan, enrollment for the Envision RX Plus will be required between October 15th and December 7th. Envision is planning on making this easier for you. You would not need to go through a full enrollment application. There'll be a simplified process. My understanding is you may be allowed just to make a phone call or go to the website to indicate you would prefer to keep the Envision RX Plus plan. I will reach out to all clients who are currently enrolled with Envision RX Plus with me as the agent. As October 15th approaches, I'll be tracking this to make sure that if you want to keep it, you take the appropriate steps. Humana Walmart members. Now, it's my understanding Humana Walmart members will be automatically switched into a more expensive plan within Humana. Humana is offering 3 plans for 2020. And similar to the Envision situation, if you would like to keep the lower cost Humana Walmart plan, re-enrollment will be required between October 15th and December 7th. I have not received any communication from Humana as to how this will be accomplished. You may need to go through a full enrollment process. With Humana, I'll be coordinating all efforts with URL Insurance Group to make sure that you have the plan which is most appropriate for you. All right, folks, that's just a quick update. My goal is to hold these meetings each Friday to give you the opportunity to express your thoughts, ask questions. So if you have any questions, please let me know. Okay, the first question is, when will I be contacted by URL Insurance Group? Well, the first step would be to accept the scope of appointment confirmation, and you will then be contacted for an appointment, and the appointment will occur between October 15th and December 7th. All right, if I choose to stay with my current plan, do I need to do anything? It depends. Again, as I discussed with Envision and with Humana Walmart, the company is automatically making a change for you. So if you take no action, you will be agreeing to the change. Most plans, however, you would not need to take any action. You would be automatically enrolled. Everyone should have received an annual notification of change, which would indicate what is happening for your given plan. All right, I'm currently with Aetna. What is the deal with WellCare? Well, WellCare has acquired the Aetna business. So the Aetna plans are basically continuing for 2020, but the business is now owned by WellCare. Okay, are Envision prices increasing? Well, the premium is actually being lowered for 2020. So the easy answer is no. However, as you know, it's very important to run a review to determine if it's in your best interest to stay with the plan. It really comes down to the medications that you're taking. So Dennis, I hope that answers your question. Are there any Part D plans which cover vitamins? Not to my knowledge, no. Vitamins are not covered by the prescription drug program. No. If I choose to stay with my current plan, do I need to do anything? I've already addressed that one. How does Mutual of Omaha work for the annual election? Any changes proposed for this year? I do not represent Mutual of Omaha for its prescription drug plan. I do represent Mutual of Omaha for Medicare supplement plans. But are there changes? Yes, there's a different premium. There is a different deductible for 2020. And this is from Charles. Charles, I would encourage you to take advantage of the free review to determine if it's in your best interest to stay with the plan. Do you handle AARP Medicare supplement plans? I certainly do, yes. And in fact, as an insurance agent for the past several years, United Healthcare has been my number one company. And nationwide, United Healthcare is the number one provider of Medicare supplement with over 4.5 million members. So if you have any questions regarding that, I will gladly help you. Your name did not post, so if you need any help, just email me and I'll do my best. How do I contact URL? Well, URL should be contacting you. This is Steve. Steve, you should have received my email with the review request form. And if you complete the review request form, please fully complete it. Folks, if you haven't sent in your form yet, signature is required. Please send it in. And Steve, the form will come back to me. I'm tracking it. I'm forwarding it to URL for tracking purposes. And then URL will initially send you an email indicating that you have been referred by me and you will soon be contacted. The second step for URL is then to send you an email, which is an electronic scope of appointment form. And you would complete that form, which would allow a URL representative to schedule an appointment with you after October 15th. Kevin, I believe the Humana Walmart plan is no longer offered and it's changing its name to the Humana Premier plan. That may very well be. I'm not working with Humana for this year. What's happening with the Humana Walmart plan is it's being automatically switched to a more expensive plan, the Premier plan. Humana does have a lower cost plan. I'll have to check to see if the name is still Humana Walmart. But the person who asked this question, that your name didn't post. But again, you want to make sure that it's in your best interest to stay with the Premier plan, which I doubt. If someone's currently with the Humana Walmart plan, the Premier plan likely would not be in your best interest unless your medications have changed significantly. When can we expect URL to send the scope agreements? This was from Joe. Joe, you're actually going to be hearing from me because of the plan that you currently have. So you and I are going to be working together because of your unique situation. What if I have not received annual notification letter? Well, you need to contact the carrier regarding that, or Nina, you could send in the form and you'll be contacted and we'll have a review of all the available forms for you, or all the available companies, all the available companies. I'm currently with United Healthcare Plan G. Are those costs to me the lowest? All right, your name didn't post, whoever asked that question, but it depends. It depends on where you live, your age, whether you're married, whether you're living with someone. So it depends. It would probably be best if you sent me an email and we can take a look at. Remember, there is no election or enrollment period for Medicare Supplement. You may change your Medicare Supplement plan at any time. However, unless you're new to Medicare Part B, you will need to disclose information about your health, and your acceptance for the new coverage is not guaranteed. Should I consider going with another company such as Mutual of Omaha? Again, it depends. If you'd like to make a change, you may do so at any time. I could discuss with you whether it's appropriate, but keep in mind a change would require you to disclose information about your health, and your acceptance would not be guaranteed. Does the notification you just mentioned come from you, or in my case, from Aetna? Given the company change, will a new card be mailed? Yes, I believe that the question is anyone who has one of the Aetna plans that has now been taken over by WellCare, yes, you should be receiving new ID cards with the WellCare name on the card. How to get better economic coverage for Tier 3 and Tier 4 drugs. Leo, take advantage of the review. So each company has its own formulary or listing of covered drugs. Many plans for 2020 have introduced deductibles. The SilverScript Choice Plan, for example, has been a very popular plan. For 2019, the SilverScript Choice Plan in Maryland was the lowest cost plan in terms of premium with a zero deductible. Well, SilverScript has introduced a deductible on the SilverScript Choice Plan for 2020, and it'll be imposed on medications classified as Tier 3 or higher. This is why the review is so important. So anyone that has a plan taking medications classified as Tier 3 or higher, it may be appropriate to make a change. And one of your Tier 3 medications may be covered by one company, but not on the formulary for a different company. So let's take advantage of the review, Leo, and see if you can save some money. I have Humana, not Humana Walmart. What is the difference? Charlie, for 2019, Humana has 3 plans. The insurance company is Humana, and there is a Humana Walmart plan, Humana Preferred plan, and a Humana Enhanced plan. So there are changes for 2020. You just worked with me in July to select WellCare and AARP coverage. Since it's so recent, should I submit the plan review request? Yes. What we have done in 2019 for drug purposes has no impact on 2020. Think of the prescription drug plans as calendar year plans. So what is happening for you, the planning that we had done for 2019 really means nothing for 2020. So it's important to take advantage of the review. And it's a free service to you. Why not? Who will be my agent for 2020, you or URL Insurance Group? Well, if the request has been forwarded to URL Insurance Group, and if you agree to a change with the URL insurance representative for the prescription drug plan purposes, URL will be the agent. This is what I am sacrificing in order to continue this service for you as my client. If you have Medicare supplement coverage with me, I will still be your agent. I'm still going to be your Medicare man. I'm working hard to coordinate all this for you. This webinar is an example of my way of trying to stay in contact with you. But with the Medicare changes and with the volume of requests that I received, I needed to do something, and I thought taking advantage of URL Insurance Group was an appropriate decision. Now, that question was asked by Joe. Joe, you and I are going to be working directly because of your unique situation. If retail costs plus premiums are less than the deductible, should you cancel Part D? Well, Bert, that's a good question. I'm going to make it a little more general. Often people ask me, well, I'm taking low-cost medications or I'm not taking any medications. Why should I have a Part D prescription drug plan in place? Well, if you do not have a Part D plan in effect, a penalty will accrue and will be assessed if you enroll in the future. So let's say someone became eligible January 1st of 2019 for Medicare and chose not to enroll in a plan and then chooses to enroll at this time. Well, that person would have a 12% penalty, a lifelong penalty, which would be assessed on whatever the average premium is each year. So someone could have a drug plan in place for 2019 as low as $14 per month, but the penalty would be based on a $35 premium. So, Bert, you run the risk of being uninsured for a period of time. If you were to call me mid-year and say, I've had a change in health and now I need expensive medications, help me get onto a prescription drug plan, you'd be locked out until this period of time, the annual election period. You would be permitted to enroll for January 1st, and then you would be penalized, and the penalty would be for life. My Humana premium is more than doubling. What is my best move? Your best move, this is Margaret, your best move is to return the fully completed review request form, and let's find out which plan would serve you well for the upcoming year. Are there any changes to the Cigna plan? This is Jay. Jay, you got me. I don't represent Cigna. In fact, Cigna, until this year, didn't even work with independent agents. But as I stated earlier, consider your plan to be a calendar year plan, and I would recommend sending in the form. Let's let URL do a review, see if you're well served keeping the Cigna plan or making a move. Will Envision be mailing me a paper on which to re-elect RX Plus? I don't think so. This is from Max. I don't think so. I think that you're going to be receiving an email from the company. You're going to be offered the opportunity to call in. I'm not aware of paper, but as I said earlier, I'm going to be coordinating this. I am your agent now for the Envision plan. I'll be in contact with you as October 15th approaches to let you know what steps you need to take. If you want to keep Aetna now, WellCare, do you have to do anything? No, you do not. You don't have to take any action. The Aetna Select, the Aetna Saver plans are continuing under the WellCare name, so you wouldn't have to take any action. But I'm going to repeat, Nancy, it may be in your best interest to send in the form. Let's make sure you're still well served with Aetna. Can you resend it? This is Steve. Can I resend? Are you referring to the form, Steve? I'm going to assume yes, and I will make a note to email you the form. Let me make a note here quickly. Okay, so I will send out the review request form. All right, I'm going to keep going. We have just another couple of minutes. So I'm going to stop answering questions for a moment. I'd really appreciate comments if you think this is helpful. I was thinking of doing this every Friday, just an informal webinar such as this, some highlights, some information that I'm picking up, request comments from URL to make the process go easier. So if you think this is helpful, please let me know and I'll keep it going. I will go until 9:30 as promised. If a question is posted that I do not answer live here, I will email the person who asked the question. Is there any disadvantage to signing up with URL? Not to my knowledge, Michael, no. URL is staffed with licensed representatives. I've explained why I formed a partnership with URL, because I want to continue this annual review service. It's just that the handcuffing of me with the Plan Finder tool forced me to take advantage of URL Insurance Group. And of course, you always have the option of running your own review or calling Medicare if you're uncomfortable with URL. Can you resend email for URL? Okay, so another request. I assume that's for the form, Glenn. I will take care of that for you. Will United Healthcare be offering high deductible Medicare Plan F in 2020? If so, what will the premium be? No, there will not be a high deductible Plan F. Plan F is being eliminated for sales to new Medicare beneficiaries starting in 2020. So the companies are now moving to a high deductible Plan G. And if you want to make that change, you do need to disclose information about your health. All right, so I'm going to take one more, and then any other questions listed, I will take care of via email. Thank you very much for listening as we approach 9:30. So Humana Preferred is going to Humana Basic. Okay, thank you, Charlie. Well, that was a quick one, so one more. What is a scope of appointment and why is it necessary? Scope of appointment is a required form by Medicare. It's basically a permission slip for you to provide to an agent to contact you about Medicare products. So anyone that wants to have that discussion and or enroll, if audited, the insurance agent would need to produce that permission slip for Medicare. Well, folks, that concludes our first conversational webinar regarding Medicare. If you'd like me to do another one for next week, I'd appreciate your comments. And thank you for listening. Have a great day today.